Okay, let's dive right in. If you're in healthcare, you know the 3 Ds, disorientation, delirium, and dementia, are a really big deal. You're going to see them on your exams, and you're definitely going to see them in practice. Getting them straight is absolutely essential. So think of this as your high-yield study guide, the stuff you really need to know to lock these concepts in.
So here's our game plan. We'll start with the basic definitions, then jump into the most important comparison, delirium versus dementia. After that, we'll zoom in on dementia, talk about what good care actually looks like, and wrap up with the impact on caregivers. Simple as that. Let's get to it.
So put yourself in this situation. You've got a patient who was totally fine yesterday, and today they're suddenly confused, agitated, just not themselves. What's at the top of your list? Is it delirium? Is it dementia? This is the core question, right? Because your answer is going to completely change what you do next. All right, time to build our foundation. Before we can tell these things apart, we have to be super clear on what each one actually is. So let's lock in some clear, simple definitions.
First up, disorientation. This is just a state of confusion. Maybe someone doesn't know who they are, where they are, or what day it is. But here's the most important takeaway. Disorientation is a symptom, not a disease itself. Think of it like a check engine light in a car. It's just a sign that something else is going on under the hood. Next up, delirium. The words to burn into your brain for this one are sudden, severe, and temporary. This is not a slow burn. This is an explosion. And this is critical. Delirium is a medical emergency. Why? Because it's always a sign that there's an underlying physical cause, like a UTI, a new medication, or some other illness that needs to be treated right now.
And our third D is dementia. Now, where delirium was sudden, dementia is progressive and irreversible. It's a slow, gradual decline. It helps to think of dementia as a big umbrella term. Underneath that umbrella, you have specific diseases, and the most common one is Alzheimer's. The key here is that this is a long-term condition, not a quick change.
Okay, listen up, because this right here is the most important part of this whole explainer. Seriously, if you only remember one thing for your test, make it this: how to tell the difference between delirium and dementia. Let's break it down. I'm pausing here for emphasis because it's that important. Getting this right is everything. It's not just about passing a test, it's about patient safety. So get ready to take a mental snapshot of this next slide. Okay, here we go. This table is gold. Let's walk through it. First, onset. Delirium is sudden, like we're talking hours to days. Dementia is gradual. It happens over months or even years. Next, course. Delirium fluctuates. The person can be clear 1 minute and totally confused the next. Dementia is a steady, downhill, progressive slide. Duration. Delirium is temporary. You treat the cause, it gets better. Dementia is permanent. And last, attention. This is a huge clue. With delirium, attention is all over the place, highly impaired. But in the early stages of dementia, attention can actually be pretty normal. Memorize this table. It's your key. So now that we've nailed that key difference, let's zoom in and take a closer look at dementia. It's so easy to just think, oh, that's memory loss. But trust me, it is so much more than that. It's just the tip of the iceberg. Here's a fantastic mnemonic that's perfect for exams, the 4 A's of dementia. First, you've got amnesia. That's the memory loss we all know about. Then there's aphasia. That's trouble with language, either finding the right words or understanding them. Next is agnosia, which is the inability to recognize things, like a common object or even a loved one's face. And finally, apraxia, which is difficulty with motor skills, like being unable to button a shirt. These 4 really show you how widespread dementia's effects are. Dementia also tends to follow a pretty predictable path. It starts with the mild stage, where you might see some memory issues, but the person is still mostly independent. Then it moves into the moderate stage, where the confusion gets worse and they start needing help with daily life. And finally, it reaches the severe stage, where the impairment is profound and they become completely dependent on others for everything. Okay, so we've got the book smarts down, but how do we take that knowledge and actually use it to provide great, compassionate care? This next part is all about putting theory into practice. This right here, this is a total game changer. When someone with dementia gets agitated or starts wandering, they're not just being difficult. They are trying to communicate something. We call these responsive behaviors. Our job is to be a detective. What's the trigger? Are they in pain? Are they hungry? Scared? Is the room too loud? Once you start looking for the why, your whole approach changes. And this slide shows one of the most powerful tools you have, validation therapy. On the left, you see what doesn't work, correcting them. Saying your mother died years ago just causes distress. Now look at the right. Instead of correcting the fact, you validate the feeling. You must miss your mother. Tell me about her. You're joining them in their reality, and that builds trust and reduces anxiety. It's a simple switch, but it is so powerful.
So here are a few more really practical things that can make a huge difference. First, routine, routine, routine. Predictability is comforting. Second, communicate simply, short sentences, one idea at a time. Third, break down tasks. Instead of get dressed, try put on your right sock. And of course, always make sure the environment is safe. These aren't complicated, but they are incredibly effective.
And finally, we can't talk about dementia without talking about the caregivers, because this disease doesn't just happen to one person in a vacuum. It happens to a whole family, a whole support system. We have to remember that being a primary caregiver for someone with dementia is an absolutely monumental job. It is physically exhausting. It is emotionally draining. It can be a huge financial burden. All of this puts them at an extremely high risk for burnout and feeling completely isolated from the rest of the world.
And that's exactly why something called respite care is so vital. All it means is giving the primary caregiver a break, temporary relief. It's not a luxury, it's a necessity. It's what allows them to recharge their batteries so they can continue to provide care for the long haul. So let's end with this. We've covered the definitions, the differences, the strategies, all the stuff that's going to help you ace your exams. But the real test, the one that truly matters, comes later. It's about using all this knowledge to provide care that is not just clinically correct, but deeply human. So the question I want to leave you with is this: how do we always remember to honor the person behind the diagnosis? Because that, at the end of the day, is what it's all about.